Hi, my name is Jon McLaughlin from Therapeutics and Motion Massage Bodywork, and this is Joe Jackson. Today we're going to be talking about treatment of the Quadratus Lumborum muscle of the lower back. And it's a muscle, I'm going to have Joe turn here, a muscle that is in the low back. It's one of the deeper intrinsic lower back muscles. Very common for it to be involved with lower back pain. A classic way for this muscle to spasm or become injured is lifting a heavy object with your back, improper lifting and rotation at the same time. This time I'm going to have Joe get on the table here. Joe, face down with your face in the face cradle. All right, is that comfortable for you? Mm-hmm. Okay, excellent. And to demonstrate where this muscle lies, I'm going to put a spine model on your back. Is that okay?
Absolutely.
All right. So here we have our spine model, lying about like so. And the Quadratus Lumborum muscle is on both sides and lies between the 12th rib, that is approximately here on Joe, and lumbar vertebrae, the transverse processes of lumbar vertebrae 1 through 4. Also attaches to the posterior iliac crest. Now this muscle, its actions are to laterally flex the spine, and also it does hip hiking, so this iliac crest hikes upward. Facilitates when you're going up stairs or walking. To find this muscle, I'm going to palpate first and find Joe's iliac crest here, a little bony ridge right off of the lumbar spine, and going north superior, I'm going to find his 12th rib. Now going laterally with my thumbs, I'm going to go deep and hook my thumbs inward towards his lumbar vertebrae. The reason why I'm not pressing down into this, his back muscles, for one, we have this diamond-shaped fascial sheet that's very thick called the thoracolumbar fascia. And then below that we have his paraspinal muscles, the lumbar erector spinae. So we want to get in from the side and hook underneath that erector spinae. When the Quadratus Lumborum muscle is tight or spasmed, there can often be tender points. Is that tender at all?
A little bit.
A little bit, okay. Sometimes we get trigger points in this muscle that can refer down into the glutes or out into the hip joint on this side, demonstrating glutes and hip would correlate with also his right side. So for a little bit of treatment, first, just getting in there, hooking my thumbs, and getting some pinpoint compression. Also, just want to check in with Joe, make sure it's not too uncomfortable. Is that okay?
Yeah, it's okay.
Yeah, okay, great. And back out, find another spot as well. Hook in with my thumbs. With some pressure. We may need to hold this spot for up to 90 seconds. I'm also going to work the attachment point right at the posterior iliac crest here. On Joe, it's pretty stiff and tight. So I'm going to, instead of just using my thumb pressure, I'm going to back up, then really use the pressure with my other hand, using my thumb as the tool. So I'm just hooking my thumb underneath the iliac crest there. working my way out the edge. I can already feel that softening.